for Spinal Health and Nutrition. Today I'm going to talk about an interesting topic called TMJ. TMJ stands for Temporomandibular Joint. But today I'm going to talk about Temporomandibular Joint Disorder. It's a very common condition that I see all the time in my office, especially my patients coming in from auto accidents, slip and falls, and sports-related injuries. What is TMJ? Like I said, it is a condition called Temporomandibular Joint Disorder. Okay, the temporomandibular joint is actually located on both sides of the ear, actually in front of the ear on both sides. That's where the skull connects to the joint, right along here. Okay, in between each joint, there's a cartilage called a disc for support against gravity and also rotation. If you move the jaw side to side like that, up and down while chewing. What are the signs and symptoms of TMJ disorder? Popping or clicking of the jaw, pain around the jaw, ear aches and headaches, grinding around the jaw, and it's also painful when someone is applying pressure along the jaw area. Okay, so those are the symptoms, especially clenching of the teeth. Okay, so the causes are clenching of the teeth. All right, any type of injury to the jaw area, especially if having an athlete who's involved in the contact sport, boxers, they take a direct blow to the side of the face. Football players, they can also get it. Someone who's been in an auto accident, they receive a direct contact to the face by the airbag. That can also cause it. And also some people have a tendency to grind or clench their teeth, especially if they're under a lot of stress or going through anxiety. All right. So I'm gonna have my patient come in. I'm going to show you all a very simple chiropractic technique as to how we diagnose the TMJ and treat the TMJ disorder. Okay. Let's see right here. Okay. So I understand you've been having some issues around the jaw area, right?
Yes.
Okay. Is it painful when I apply pressure here?
Yes.
Okay. Now, do you also experience any popping or clicking when you're opening your mouth or chewing your food?
Yes, I do.
Okay. Now, how long have you been having that problem?
For about a month.
Okay. Do you notice that when you sleep at night, you grinding or clenching your teeth?
Yes.
Okay. Yes. I remember you told me that the dentist told you that you had to take it easy because they can tell you've been grinding or clenching. Okay.
Yes.
One of the things that we do to diagnose a TMJ is that we take a history and then we also do our exam. All right. Simple exam is we pretty much palpate the area open wide. Okay. And I can actually close it. I can actually feel the grinding and popping of the jaw area. Now, the important thing that we do is that we also take an x-ray. We want to make sure that we rule out any fractures or any contraindications that may want us to refer out to an orthopedic surgeon if there's any type of fractures or breaks around the jaw area. Do you also experience any headaches with that?
Sometimes.
Sometimes, okay. All right. I can have you lay down on your back. So basically, it's a very simple technique that I'm going to do to help clear out the TMJ problem. It's very simple. Okay, I feel for any misalignments around the joint area. Okay, if I see any deviation of one side being up towards the other is uneven, then that's the side where I'm going to actually treat the joint area. All right, and I can see that the TMJ on her left side is deviated in the upward position versus the left side is going down. Okay. And this is where she feels most of her pain, which is on the left side. So I'm generally going to take her head this way. I'm going to place my hand on the jaw area. I'm going to slowly move her head this way and apply a very fast, light adjustment down this way, just like that. Okay? All right, open wide. How does that feel? Feels a little better, right? Perfect. Okay, you come on up. Good. All right. So another thing that I do is that I give my patients exercises to do for the jaw area. I have them work on slowly opening mouth wide up and close it, open and close it back and forth, and also moving their jaw area side to side like that, okay? The purpose for doing that is to help loosen up the joint area, because if there's no movement, that can also lead to a lot of stiffness on that joint area and going back to the grinding and popping of the joint. All right. There are other treatments as well for the TMJ, physical therapy exercises, and other additional exercises that they can do. But the chiropractic care is a very simple, gentle technique to help clear out TMJ problems. Okay? If you have any issues with that TMJ, it's been going on for quite some time, it's annoying to you, and you're tired of having that pain and stiffness around the mouth area, difficulty eating, definitely see a chiropractor and we can get that squared away. Once again, I'm Dr. Lewis with Spinal Health and Nutrition. Please subscribe and share to our YouTube channel. And remember, your health is your greatest investment.